So in terms of treatments now in Florida, you're going to have, you get infected with COVID and you meet the criteria where you're at higher risk for hospitalization, you could go and do a traditional monoclonal antibody therapy, Regeneron, sotrovimab, and the like. If you've been exposed and you fall into that category, you can do those same monoclonals. But if you're somebody in those other high-risk categories where you do it not having any exposure to COVID, not being infected, doing it to provide some long-lasting protection, this is now filling that particular niche. And so, because you think about it, if you're somebody that is a transplant patient and, the vaccine isn't recommended for you, then to wait till you get infected and treat it, yeah, the treatment has been good, but you could do this before you're ever exposed, and potentially it will mediate any infection that you get. So, and it is not authorized for post-exposure prevention. So I just want to make people clear about that. It's really a preventative for folks who fall into those categories. And it's not vaccinated or not. I mean, there are a lot of people who fall into those immunocompromised who did get vaccinated, but their bodies just didn't mount a sufficient immune response. So they would be eligible as well. So initially, we have a very limited allocation. It's about 3,100 doses. And this initial allocation is going to go to hospitals and clinics that are already administering monoclonal antibody treatment to patients, including right here in Ocala. And the way we tried to allocate it was just say, okay, can we get it within a 2-hour drive of everyone in the state of Florida? It's easier to do that in some areas than others, but that's what we've been able to do. So you have some folks that are maybe in more rural areas. We can't make it next door with such a limited amount, but if you get into the car, do this. This is a pretty significant thing to do, so we feel that it would probably still be worth it for some folks to do it. So that's how we've tried to get it going in the interim. So we have all the locations that administer this, not just the new AstraZeneca product, but also the Regeneron and the sotrovimab. And you can go to floridahealthcovid19.gov, and it will have all those sites located. You can go in, you can make appointments, you can do what you need to do. But I think this is a positive development to be able to have this, especially given that it really will serve a valuable purpose for some of those folks who are at very high risk and do need some additional help. So